Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2018. Number 031. During autopsy of a 34-year-old man, who died of chronic kidney failure due to renal amyloidosis, in the lungs, mainly in the lower lobes, the pathologist detected multiple bronchial dilations filled with purulent masses accumulated in the bronchial lumen. Surface of the lungs section has fine mesh pattern and resembles a honeycomb. Histologically, there is a chronic inflammation detected in the bronchial wall. Muscle fibers are replaced with connective tissue. These changes in the lungs can be defined as A. Bronchopneumonia, B. Chronic pneumonia, C. Bronchiectases, D. Chronic bronchitis, E. Lung abscesses. Honeycomb lung indicates interstitial fibrosis, which may be mimicked by severe cystic bronchiectasis, particularly in patients with cystic fibrosis or tuberculous bronchiectasis, and severe cystic disease, as seen in lymphangioliomyomatosis. Dilated and thickened terminal and respiratory bronchioles produce cystic air spaces and give the presence of small cystic spaces with irregularly thickened walls composed of fibrous tissue on chest X-ray. Bronchiectasis is a disease in which there is permanent enlargement of parts of the airways of the lung. Symptoms typically include a chronic cough with mucus production. Other symptoms include shortness of breath, coughing up blood, and chest pain. The answer is C. Bronchiectases.